Providence Swedish Heart and Vascular Institute is the largest cardiovascular care center in the Pacific Northwest. We provide excellent surgical and medical care and a very collegial and collaborative environment.
The care we're provided here is really unique because we have the comprehensiveness and also the most innovative advanced technologies. So that means a patient with any type of cardiovascular disease can seek care at our institute. But at the same time, for the most complex patients, they will get the expert top of their field in the entire nation to be caring for them with the most innovative treatment options for them.
I came over here to start up an advanced heart failure program at Swedish. And one of the mainstays of a program like that is mechanical support devices for cardiogenic shock. We didn't have one at the time here, and so we engaged into a 6-month process of creating this. One of the biggest things about the program is that we do a lot of informatics. We do a lot of assessment of outcomes, where we could do better, what labs were necessary, what treatments were necessary. So it's always a program that's in growth. What we've been able to do with it is have extraordinary outcomes. The program continues to grow about 20% every year. Through it, we also were able to get donations to build a simulation center. I was able to purchase a whole simulation program that helps us create scenarios for ECMO for the nurses as they go through training. And more recently, we were able to purchase simulations for cannulation. So as we expand our program to many centers regionally with a plan to cannulate on site and transfer, we're working on a situation where standardization is the key to success.
Very passionate about making sure that we have all the resources brought to focus on the patient as soon as possible, and that we can design a treatment based on a multidisciplinary assessment of the patient in real time.
I got involved in the quality side of cardiac surgery in the, believe it or not, kind of mid-90s, when I felt like that we did not have an organized multidisciplinary approach to our quality. And that was true nationally. It wasn't just us, it was everywhere, but we were kind of really early on to the process of trying to get everyone at the table to discuss all of the issues that can happen with patients from beginning to the end of their discharge.
I love it here. I love the area. Seattle is great, you know, right on the water and the mountains, a lot of outdoor activities to take advantage of. And the program itself, obviously, is very conducive to having mid-level practitioners like myself. We work very collaboratively with the surgeons here. We have a fair bit of autonomy for our role, and it's worked out very well. We have a good life balance.
We're very proud of the research program in general. It is primarily a clinical research program where we study patients and patient outcomes and study new therapies, study new devices, study new diagnostic techniques. The thing that we're particularly proud of is the diversity of the clinical research that we do here. Primarily, yes, we do a lot of cardiac surgery research, including cardiac anesthesia research. But in addition to that, we've done a fair amount of work with new devices, new drugs, both for interventional cardiology as well as heart failure medications. And more recently have been involved in lipid therapies, which we've been very excited to participate in. An exciting new area is actually the management of hypertension, which we think will be a blossoming field in the years to come as well.
Our idea is to say yes, and what we want to do is we realize that other systems can be challenged. We understand that when somebody has a complex cardiovascular condition in an outside hospital or an outside emergency room, that timeliness of care is so important. And so we've been working tirelessly to try to be able to know what our resources are so that we can say yes each and every time and just take care of it.
What I think is really unique at Providence Swedish Heart and Vascular Institute is this duality of adapting the very rigorous data-driven approach, almost like a research academic medical center, to optimize the clinical quality and outcomes. But at the same time, it's deeply rooted in the history of Seattle. Being the first hospital and the largest nonprofit health system in the greater Seattle area, we are so connected with the community. And we want to make sure that we stay connected to the community. The amount of philanthropic contribution we get from our patients in the area is a testament of the community aspect of our organization.
I think what excites me most about the future is that recently we've achieved true clinical collaboration over a variety of different care pathways. I feel that we're in a position to grow that and to refine it in order for our individual ministries to serve their communities in the best possible way while maintaining and respecting their heritage.